Today I'm going to talk on the topic of provision for special right and privilege for disability through legislation. Introduction. Children with disabilities and their families constantly experience barrier to the enjoyment of the basic human rights and to the inclusion in society. Their abilities are overlooked, their capacities are underestimated, and their needs are given low priority. Yet, the barriers they face are more frequently as a result of the environment in which they live than as a result of the impairment. Well, the situation for these children is changing for the better. On the positive side, there has been a gathering global momentum over the past 2 decades, originating with persons with disabilities and increasingly supported by civil society and governments. The Disabilities Conventions offer a unique opportunity for every country and every community to re-examine its law and institution and to promote change necessary to ensure that persons with disability are guaranteed the same rights as all other persons. It expresses basic human rights in a manner that addressing the special needs and situation of persons with disabilities and provide a framework for ensuring that those rights are realized. Understanding barriers to inclusion, the social model of disability acknowledges that obstacles to participation in society and its institution reside in the environment rather than in the individual. And those barriers must be prevented, reduced, or eliminated. They are reflected in policy and regulation created by government. Such obstacles may be physical, for example, barrier in public building, transportation and recreational facilities. They may also be attitudinal, widespread underestimation of the ability and potential of children with disability, create a vicious circle of under-expectation. Underachievement and low priority in the allotment of resource. Poverty is the pervasive barrier to participation worldwide, and in both a cause and a consequence of disability. Families living in poverty are much more vulnerable to sickness and infection, especially in infancy and early childhood. They are also less likely to achieve adequate health care or to be able to pay for basic medicine or school fees. The cost of caring for a child with a disability creates further hardship for a family, particularly for mothers who are often prevented from working and contributing to family income. Needed actions are the articles of Convention on the Rights of Persons with Disability spell out the specific area that need to be addressed, as well implementation and monitoring mechanism. These are complementary to the recommendation issued by the Committee on the Rights of the Children to Government. A major task for international agency and the national partner is to ensure that persons with disabilities are automatically but implicitly included in the initial objective, targets and monitoring indicator or all development programs, including with those formed by the Millennium Agenda. The importance of Millennium Agenda. Number 1. Promoting the rights of children with disabilities of all legislation in order to ensure its conformity with this standard. In particularly, the inclusion of children and elders with disability. All relevant legislation and regulations should include a provision of discrimination on ground of disability. Number 2, provide effective remedies in case of violation of the rights of children with disability and ensure that these remedies are accessible to all children, families, and caregivers. Number 3, develop a national plan of action that integrate the relevant provision of all applicable international instruments. Such plan should specify measurable and time-bound target as well as evaluation indicator and should be resourced accordingly. Number 4, create a focus point for disability in its relevant department as well as height-level multi-sector coordinating committee with members drawn from relevant ministries and organizations of persons with disability. The committee should be empowered to initiate proposals, suggest policy, and monitor progress. Number 5, develop independent monitoring mechanism such as an older persons or children's commissioners and ensure that children and families are aware of all fully supported in gaining access to such mechanism. Number 6, make concentrated effort to ensure that the necessary resources are allocated to and for the children with disability and their families. This includes free primary and secondary education in accessible buildings, training of teachers and other professional, financial support and social security. Each child should be provided with appropriate individual support including assistive device, sign language, brilliant materials and a differentiated and accessible curriculum. Number 7, establish program for the disinstitutionalization of children with disabilities, placing them with the family or with foster families who should be assisted with professional and financial support. National standard of care and appropriate training should be in place and rigorously monitored to safeguard the right of those children that remain in institution. Number 8, conduct awareness raising and educational camping for the public as well as specific group of professionals with the aim of preventing and addressing the de facto discrimination of children with disabilities. Number 9, implement a system of community service and support for children with disabilities. Number 10, ensure that organization of persons with disability are consulted in relevant planning and policy making and are duly represented and financially supported in extending their activities. Next point, that is employment. Equal opportunity for employment. No disabled person shall be denied access to opportunity for suitable employment. A qualified disabled employee shall be subject to the same terms and conditions of employment and the same compensation, privilege, benefit, fixed benefit, incentive or allowance as a qualified able-bodied person. 5% of all casual, emergency and contractual positions in the Department of Social Welfare and Development, Health, Education, Culture and Sports, and other government agency, office or corporation engaged in social development shall be reserved for disabled person. Shelter employment. If suitable employment for disabled person cannot be found through open employment as provided in the intermediately preceding section, the state shall endeavor to provide it by means of shelter employment. In the placement of disabled person in shelter employment, it shall accord due regard to the individual qualities, vocational goals, and inclination to ensure a good working atmosphere and efficiency production. Next, that is apprenticeship. Subject to the provision of Labor Code as amended, disabled persons shall be eligible as apprentice or learner, provided that the handicap is not enough as to effectively impede performance of job operation in the particular occupation for which they are hired. Provided further that after the lapse of the period of apprenticeship, if found satisfactory in the job performance, they shall be eligible for employment. Next point, that is vocational rehabilitation. Consistent with the principle of equal opportunity for disabled workers and workers in general, it shall take appropriate vocational rehabilitation measure that shall serve to develop the skill and potential of disabled person and enable them to compete favorable for available productive and remunerative employment opportunity in the labor market. Next point, that is vocational guidance and counseling. The Department of Social Welfare and Development shall implement measures providing and evaluating vocational guidance and counseling to enable disabled persons to secure, retain and advance in employment. It shall ensure the availability and training of counselors and other suitable qualified staff responsible for the vocational guidance and counseling of disabled persons. Next point, that is implementing rules and regulation. The Department of Labor and Employment shall, in coordination with the Department of Social Welfare and Development and National Council for the Welfare of Disabled Persons, shall promulgate the rules and regulations necessary to implement the provision. The next point, that is education. Assist to quality education. The state shall ensure that disabled persons are provided with adequate access to quality education and impulse opportunities to develop their skills. It shall take appropriate steps to make such education accessible to all disabled persons. It shall be unlawful for any learning institution to deny a disabled person admission to any course it offers by reason of handicap or disability. The state shall take into consideration the special requirement of disabled persons in the formulation of educational policy and program. It shall encourage learning institutions to take into account the special needs of disabled persons with respect to the use of schools facilities, class schedule, physical education requirement, and other pertaining consideration. The state shall also promote the provision by learning institutions, especially higher learning institutions, of necessary service that will facilitate the learning process for disabled persons. Next point, that is assistance to disabled students. The state shall provide financial assistance to economically marginalized and deserving disabled students. Post-secondary or tertiary education. Such assistance may be in the form of scholarship grant, student loan program, subsidies, and other incentives to qualified disabled students in both public and private schools. Next point, that is special education. The state shall establish, maintain and support a complete, adequate and integrated system of special education for the visual impaired, hearing impaired, mentally retarded persons and other types of exceptional children in all regions of the country. Towards this end, the Department of Education, Culture and Sports shall establish special education classes in public schools in cities or municipalities. Vocational or technical and other training program. The state shall provide disabled persons with training in civics, vocational efficiency, sports and physical fitness, and other skills. The Department of Education, Culture and Sports shall establish in at least one government-owned vocational and technical school in every district a special vocational and technical training program for disabled persons. It shall develop and implement sports and physical fitness program especially designed for disabled persons, taking into consideration the nature of their handicap. Next point, that is non-formal education. The state shall develop non-formal education program intended for the total human development of disabled person. It shall provide adequate resource for non-formal education program and project that cater to the special needs of disabled person. Next point, that is state university and college. Number A, the development of materials, applies and technical aids for disabled person. Number B, the development of training materials for vocational rehabilitation and special education instruction. Number C, the research on special problems, particularly of the visual impaired, hearing impaired, speech impaired, and orthopedical impaired, student mentally retarded, and multi-handicapped, and others, and the elimination of social barrier and discrimination against disabled person. And number D, inclusion of the special education for disabled course in the curriculum. Next point, that is health. National Health Program. The Department of Health, in coordination with the National Council for the Welfare of Disabled Persons, shall institute a national health program which shall aim to attain the following. Number A, prevention of disability, whether occurring parentally or postnatally. Number B, recognition and early diagnosis of disability. Number C, early rehabilitation of the disabled. Rehabilitation Center. The Department of Health shall establish medical rehabilitation center in government district hospital and shall include in each annual appropriate the necessary fund for the operation of such center. The Department of Health shall formulate and implement a program to enable marginalized disabled persons to avail for free rehabilitation center in the government hospital. Next point, that is health service. The state shall protect and promote the right to health of disabled persons and shall adopt an integrated and comprehensive approach to the health development which shall make essential health service available to them at affordable cost. The national government shall provide an integrated health service for disabled persons which shall include but not limit to the following. Number A, prevention of disability through immunization, nutrition, environmental protection and preservation, and genetic counseling, and early detection of disability and timely intervention to arrest disable condition. Number B, medical treatment and rehabilitation. The Department of Health shall fill medical personnel specializing in the treatment and rehabilitation of disabled persons to district hospital and which available to municipal health center. It shall also train its field health personnel in the provision of medical attention to disabled persons. It shall further ensure that its field health unit have the necessary capability to fit prosthetic and orthotic appliance on disabled person. Now coming to the conclusion. In countries the world over, children with disabilities and their families continue to face discrimination and are not yet fully able to enjoy the basic human rights. The inclusion of children with disability is a matter of social justice and essential investment in the future of society. It is not based on charity or goodwills, but is an integral element of the expression and realization of universal human rights. The last 2 decades have witnessed a gathering global momentum for change. Many countries have already begun to reform their laws and structure and to remove barriers to the participation of persons with disabilities as full members of their communities. The Convention of the Rights of Persons with Disability, building upon the existing provision of the Convention on the Rights of the Child, open a new era in securing the rights of children with disabilities and their families. Together with the Millennium Agenda and other international initiatives, this international standard laid the foundation for each country and community to undertake a fundamental review of the situation of children and elders with disabilities and to take specific steps to promote the inclusive in